Big Rob. How you doing
Yes,
today, sir?
sir. I'm fine, sir. How
All
you
right.
doing?
All right. Doing magnificent, man. Our first guest is the chief medical doctor for Mercy Health, meaning he is the boss
The boss of all bosses.
of doctors. When there's a problem with doctors, he get it solved. And if
Quick,
anybody knows
fast, and
about
in a
what's
hurry.
happening with COVID-19 here in the Lakeshore, it is Dr. Grill. We want to welcome to the show Dr. Grill. How you doing today, sir?
Not too bad. How are you guys doing?
Doing great, man.
Just
Doing
fine.
great. First of all, you look very young to be a doctor. Might need to check some IDs. Hey, wow. How long you been chief medical doctor?
I've been the chief medical officer here at Mercy for the past year, give or take. A little more than a year, but about 1 year.
Okay, yeah, officer, chief medical officer. Forgot it. That means even more money. That's good. You replace Remington Sprague, Dr. Remington Sprague, who's definitely a friend of the show, right?
Yes, I have big shoes to fill. There's no question about that.
And when you came in last year, you got hit with the COVID-19. We did.
Indeed, it has been probably the world's worst timing to take a chief medical officer role. I will admit that. And it's been an interesting roller coaster of a first year, that's for sure.
Right. Where are we at in regards to COVID-19? I know it's been down, up, down, up. Are we down?
I wish we were down. If we would have had this conversation about 3 or 4 weeks ago, it would have had a very different tenor than what it's going to have today as we talk about this, because we're very unfortunately on our way back up.
No.
So one of the things that we watch very, very closely is the test positivity rate. And the reason that we watch that is what we've learned last spring and again in the fall is when we start to see that test positivity rate creep up, we know what's going to happen after that, and it's not good because it translates into more admissions, and then a couple weeks after that, it translates into more deaths. And to give you an idea, when I said 3 or 4 weeks ago, if we would have talked, our test positivity rate was down around 2%. We had 0 people in our hospital for a short period of time with COVID, which was amazing. But unfortunately, over the last couple of weeks, our test positivity rate has steadily increased. That today it's actually over 11% of the tests done in Muskegon County are positive. We went from 0 people that were admitted to our hospital, that when we started the day today, there were 14. I'm sure there's been at least a couple today. So we're now in the mid-teens and continuing to rise with that as well, a couple of which are in the intensive care unit. So we're definitely going in the wrong direction right now.
Are these older or younger people?
That is actually a really, really good question. One of the things we've done very well in this county is our partnership with public health around vaccination. And about 75% of our population that's over the age of 65 to 70 have been vaccinated. And that's really critically important because what we saw in the fall is the vast majority of people, when we had 150 COVID positive patients in this hospital, the vast majority of them were older individuals. And we vaccinated a significant majority of those. We are starting to see that in that test positivity rate, your average age of people who are testing positive is younger. But unfortunately, we still have about 25% of our older population that hasn't been vaccinated. And we know that they're at a much higher risk of requiring admission. And that's what we're seeing. The people being admitted still tend to be, over 60, give or take. Once in a while, we do see young people needing to be admitted, but they still are trending towards the older population requiring admission.
Have you taken the vaccine yet, Doc?
I've had both my doses of vaccine, yes.
What do you say to people that are conspiracy theorists of the vaccine? It wasn't tested long enough. It wasn't, this, that, or other. What do you say?
I think that was a much better argument back in early December before we started giving vaccines. But if you look worldwide now, especially in regards to Moderna and Pfizer, the first 2 that came out, and now even Johnson & Johnson, across this world, we have given tens of millions of doses of vaccine. And we know the safety profile of it. We know how many people have severe adverse reactions to it. The number is very low. When we talk about allergic reactions that people have been having, it's maybe 3 to 5 in a million people will have a true allergic reaction to the shot. It's amazingly well tolerated. I mean, you can look at me. I don't have a third arm. I kind of wish I did. It'd make me a little more productive. But, we know that it's very, very well tolerated. We also now know that it's very, very effective. They continue to study this after market saying, hey, how many people who were vaccinated got COVID? We know that some of them will. Even when these shots first came out, they said, hey, they're what, 90, 95% effective. That's before we talk about variants. But what we found is even those few people who do get COVID, essentially none of them get severe COVID. So if you get it and you've got cold-like symptoms for 2 or 3 days, I don't really care, right? Because you're going to be fine. You're not going to need oxygen. You're not going to need to be hospitalized. You're not going to die. And that's okay. And these shots are amazingly protective. That even if you do get it, or let's say you get a variant and your shot didn't 100% protect you, if you've just got a little bit of sniffles for a couple of days, that's okay. That's a lot better than ending up on a ventilator in our ICU.
Where are we at Mercy with the ventilators? Because I know there was a shortage of ventilators, hospital gowns, and things of that nature. Where are we at with that now?
Yeah, we're okay right now with ventilators. We only have, I believe, 2 COVID patients right now on a ventilator.
Wow.
When we,
Wow.
to your point about gowns and masks and all of that, when we started to see the test positivity rate go up, I actually reached out to our supply chain folks and I said, hey, I'm seeing the test positivity rate go up. That's not going to translate into anything for a couple weeks. But if we need anything, I want to get it now because I want to be ready that if this starts to go up again, we've got everything we need. And we do. We're well supplied with everything. If this does continue to go up, we'll be well supplied here in the hospital. I certainly don't want to see that, right? I hope that our stockpile takes us 3 years to get through all that material because we don't see another spike, but we also want to have everything that our staff needs to keep them safe, to provide good, high quality and safe care to our patients, just in case we might need it.
Wow. So is it possible to be vaccinated, get the virus, and also give it to someone else?
That's another really good question, and that's something that they're looking at right now is do vaccinated people shed virus? So if you get it and let's say you're asymptomatic, we've heard a lot about these asymptomatic carriers of the virus, right? So if you're vaccinated and you're exposed and you get it, but you don't have any symptoms because you were vaccinated, do you transmit the virus? And they're looking into all of that right now. So generally what we're telling people is if you have symptoms, whether you got the vaccine or not, if you have symptoms, you need to assume that you're contagious. But it is starting to look like if you don't have symptoms, you're probably not, if you've been vaccinated, you're probably not transmitting the virus. So vaccination is critically important when it comes to controlling this from many perspectives.
Rob and I, and our staff, a good portion of our staff took the Johnson & Johnson vaccine on Saturday. We haven't had any side effects. Is that normal? Like nothing. I was
Yeah,
questioning,
I
man, was
haven't.
anything in the vial?
That's actually another really good question that I get a lot because you see all over the news people who had these severe reactions to the shot, and then you've got people who have no reactions to the shot, and then you have people like me who are somewhere in the middle. I worked the next day. I had a sore arm. I didn't really feel the greatest, but it was no big deal for me. And you have some people like you who have no reaction. And what we're telling people is having no reaction doesn't mean that you're not protected. So everyone's immune system reacts differently. So what we know with COVID, if you get it natively, you're not, let's say you don't get vaccinated and you just acquire COVID during your normal life. We know some people from COVID get no symptoms and some people end up on a ventilator in the ICU and everything in between. So it's the same thing that we see with a shot. Some people get really, really severe reactions. Some people get medium reactions, and some people get essentially no reaction. But that doesn't mean that it didn't work. It just means that your immune system is unique to you, and yours is different than mine, is different than Rob's.
Oh, okay.
What's going on with Hackley? Is Hackley open? Is that open to help people out with COVID? What's happening with that building?
Hackley Hospital?
Yeah.
Yeah, that Hackley Hospital is closed. We did in November and December when we had that huge spike and we had 150 admitted patients with COVID, we did open Hackley up as what we call an alternative care site, an ACS. And that was open for a number of weeks so that we could help offload some of that COVID burden from the main hospital over to Hackley. But we got to a point where we were able to close that and it has not reopened. And so we've continued to move forward with the process of preparing for demolition. We're donating that site to Muskegon Public Schools, and they're going to build a new middle school there. And we don't want to delay that process for them because the voters passed the millage and they're excited to get going. And since we haven't needed that, we've passed the point of no return, so to speak. We can't put patient care there again. So that building is being prepared for donation to the middle school.
I think I've seen in Grand Rapids where they're going to allow 17 or 18 over now to get vaccinated. Spectrum Health spot. I think I've seen that. Any plans here for the young adults to get vaccinated?
So that question is actually something that's specific to the FDA. So the FDA has approved the Pfizer vaccination for age 16 and above. Johnson and Johnson and Moderna are older age limits, and so you can't actually give those down to 16 years old because it's not FDA approved for that. Now, of course, the drug companies, as you can imagine, have started testing in younger populations, but they have to do their safety studies first. But Pfizer did theirs as low as 16. So we can now give it starting on April 5th to anybody in the state of Michigan as long as you meet the age requirements. So we will be giving it to people 16 years of age and older, the
Starting next week.
Pfizer branded vaccine.
Now, what
Okay.
would happen to the helipad that's at Hackley location? Will that be now transferred to the Mercy location?
It has been, yes.
Oh, okay.
That's good. That's good. Are we in a better situation now than we were last year this time? I'm sure we are.
We most certainly are. So last year at this time, and it was right around now, where basically the entire world in the United States shut down, right? We didn't know what was going to happen with COVID. We didn't know what to expect. We didn't really, from a medical perspective, know how to treat it as well as what we do now. PPE, no one was ready for the number of N95s that we would need and things like that. All of that's passed. So we really now have treatment protocols, safety protocols. We have ample PPE. So we have everything that we need. So we're in a much, much better place than we were 12 months ago when we talk about COVID preparation.
Let's deal with some of the misconceptions about COVID-19. Are you finding that people are getting it from touching surfaces, or is it still just that airborne droplets?
So really it's both. It's a droplet. If you cough or you sneeze and all those droplets come out, and let's say I've got COVID and you walk by me and inhale that, or you get it in your eyes or something, that's how you're going to get COVID. But it's similar. Let's say we work in a similar office building and I'm sitting at a computer and I cough or sneeze, or I'm using the keyboard and the mouse, and then you sit down right after me and touch that exact same stuff. If those droplets are on there and you touch it and then you rub your eyes, you can inoculate yourself with COVID. So that's why when we talk about how do we manage this from a public health perspective, in addition to vaccination, we say wearing a mask, because when we talk about droplets, wearing a mask limits the amount of droplets that somebody who has COVID is going to put out, but it's also going to limit the number of droplets that you can take in. Number two is keeping that 6 feet physical distancing away from somebody. And then the third thing is good hand hygiene, because if you're using hand sanitizer or you're washing your hands throughout the day, if you're touching anything droplet wise and then you wash your hands, you get that virus off. So before you rub your eyes or something like that and inoculate yourself with it, if you wash your hands, then you're in a much better situation.
You being a medical doctor, do you think Michigan handled it the best way they could or should have, being a medical doctor, from the medical perspective of it, and you knowing these viruses and medicine and things of that nature?
When you say did we handle it well, do you mean the executive orders, or what
Yeah.
particularly are you
I
referring
mean,
to?
like in Florida, I stay in Florida, and the governor there kind of loose, like kind of open things up a lot quicker than Michigan. Michigan's been shut down for a while, and it's slowly opening up. Which as a doctor, which one did you agree with? What did you like to see? What worked and what didn't work?
So I'll preface this by saying I don't like being locked down any more than anybody else does. It's miserable, being confined to your home or having limited ability to go to restaurants and things like that. I want to live normal life just like everybody else. But what I will say is there's no question that if you limit the interaction between people, you limit the risk of spread of a contagious disease, COVID-19 or otherwise. And I think that what our governor chose to do through this was look at what did she believe to be the best pathway forward to limit the risk to the citizens of the state of Michigan. So you can fault her right or wrong in each individual decision that she made, but I think the way that she was going about it is saying, hey, I've got a responsibility for these people in Michigan, and I'm going to do the best that I can to try to keep them safe. And I appreciate that as a physician, having a governor that is willing to take the heat and say, okay, yeah, maybe I don't get every decision right, but if my baseline is I want to take care of my people, that's okay with me.
Now, 1 out of 4 people are vaccinated here in Muskegon County, shouldn't the numbers be going down when you got 25% of the people vaccinated?
Not quite yet. So when we talk about herd immunity, that's I think what you're getting at is when do the numbers start going down? And herd immunity is a little bit of a moving target, but basically it's you've got enough of the population in total vaccinated or have a native infection that they can't pass it around. And it's way higher than 25% is what you need for it. And the reason I say it's a moving target is if you've got something that's very, very contagious, you need more of the population to either have had it or be vaccinated to stop transmission, which makes sense, right? If it's super contagious, you need a lot more people to be vaccinated. If it's not really contagious hardly at all, many fewer people can be vaccinated to achieve herd immunity. What we know about COVID, for instance, is that it's even more contagious than influenza, the flu. So we know that we would need more people vaccinated than we typically do during the flu to achieve that herd immunity. So 25% is great. And I'll be honest with you, 25%, when we know that the majority of that 25% are our elderly population plus our healthcare workers and other frontline workers like teachers, et cetera. So we know that the people who are at highest risk were the ones that are now, by this point, fully vaccinated. That's really good news because those are the people who are at risk of needing hospitalization, the older population in particular. And now we've been going through these past few weeks and hitting some other people who have maybe higher risk factors, medically speaking. We're going down, we progressively went down in age to 65, 55. The governor's been going down and down in age. And now, like I said, April 5th, it's basically going to be open to everybody.
Wow.
No,
If you have any questions for Dr. Grill, go ahead and type your questions in. And we only got a few more minutes with him, but we want the public to weigh in if they got any questions for him. Go ahead, Big Rob.
what would you say to people that are saying that this is an experiment on people, like the Tuskegee experiment or the flu, influenza? What do you say to people like that? Because after I took the shot, I caught it when I put it on Facebook that I took it. I caught it from everybody, young, old, believers, non-believers, and everything else. What do you say to people?
Yeah, that is a great question. I'm glad that you asked that because I've received this question myself before. And what I say is this. Number one, I understand why in particular. So I'm obviously a white guy. You guys are black guys. Why the African American community asked that question? Because people like me haven't done right by people like you historically in medicine. That things like Tuskegee should never have happened, but they did. And so the way that I like to start this conversation is by affirming that that's real, it's legitimate, and it shouldn't have happened. And I understand why, in particular, our African American community asked that question because I would ask it too if I was one of you. So we need to own that. But what I say is this is very, very different than Tuskegee. If you look at what did go into the development of this vaccination, it wasn't something that they said, hey, we're going to test this only on minority populations, or we're only going to test it on white people, for instance. If you look at the people who they included in their safety studies, it was a pretty good mix of ethnicities across the board. And so we know that they gave it to a representative population of people. And as we've been given the injection, you can look and see, okay, who's got it? Is it just white people who've had it? No, it's been people of multiple different ethnicities. The reactions have relatively been the same. And it's something that is safe. For instance, the day that I was vaccinated, because even before vaccination started, we had been receiving this question. I had one of my African American colleagues get vaccinated with me, and it was one of the things that we wanted to say to the community: this is safe. This is okay for people to receive this of any color, of any gender. We wanted to help try to instill that confidence in our community. I've been on other radio shows talking about this as well. And if people have specific questions about that, I would be more than happy to answer them because the history is the history, and we can't get away from that. But I want people to understand that just because it happened historically doesn't mean that it has continued to happen. And there are many of us who are in positions of authority within medicine who have said it will absolutely not happen under our watch the way that it did way back then.
We
Okay.
got a couple online comments and questions from Gretchen Langston. Grocery store workers should have been considered essential and eligible early as well. Your thoughts on that? These grocery store workers are in the aisles, they're stocking shelves 24/7.
Hmm.
Yeah, I don't necessarily disagree with that. We have to remember that when we do talk about prioritization categories of people, that was set at several pay grades above anybody locally. So the CDC and the federal government initially was coming out with prioritization schedules. That there's an organization that specifically looks at vaccinations, not just COVID, all vaccinations, and who do we give it when there's a limitation, who gets it first. That was then modified by the Michigan Department of Health and Human Services. And then it gets down to us locally. And so decisions like when do grocery store workers count as quote unquote essential workers, that wasn't made by us. That was made at much higher levels of authority than your local people. But grocery store workers, certainly, they couldn't shut grocery stores down. They had to be there. They had to be working, and they're exposed to a wide range of population, just like we are here in the hospital. So there's no question that they were at high risk.
Next comment. It's also curious what the flu numbers look like this season.
The flu numbers don't look like anything this season. We are way, way lower on our flu numbers, which it goes to show that the things that I talked about before, hand hygiene, masking, and physical distancing, work exceptionally well to control the spread of the flu because we're not seeing it hardly at all across the entire state of Michigan. And truthfully, across the entire country, the rate of influenza spread is very, very low.
Mm.
Before we go, I'm sure in the past year you learned a lot about the nurses, frontline workers, doctors, everybody that's frontline
CNAs,
CNAs,
NAs.
all of them. What did you learn, and how did it make you feel when you got to that point and you see all this come together?
I'll tell you what, I could not be more proud of the people that I get to work with here in this hospital. So we've got a huge group of people. Like I said, when this first came out, we didn't know what to expect. We showed up at work. I still work clinically in the emergency department. I'm an ER doctor by trade, and I still do work clinically in addition to my administrative work. And we had no idea what to expect from COVID. We knew that we were intentionally placing ourselves in harm's way, and not just that as a communicable disease, something that we could take home and give to our families. But this medical community, like you said, physicians, nurses, techs, everybody involved in the care of the patient showed up to work and said, you know what, we're going to do it because that's our job, is to take care of the people here in Muskegon County. And it really is a point of pride for me to work with everyone here. I would put our staff up against anybody when it comes to the quality of care that is delivered on a day-to-day basis, and including during COVID.
And I know your staff doesn't always get a chance to see you personally, from the people who clean the rooms all the way up to the top doctor. What would you say to your staff, you know, during all of this? What would you say to them if they had an opportunity to sit down with the top doctor? What would you say to them?
I would thank them. I would thank them for what they've been doing. You know, you talked about people who clean the rooms, and you think about how critical that role is during a pandemic, right? These people don't get a lot of credit ever in their professional life, but when they show up to work, they're cleaning the rooms of these people with COVID. If they miss an area, that's putting everybody at risk. So they put themselves in harm's way to clean that room up, but they're doing it so that the next person who walks into that room has a safe environment in which to be cared for. And that's what I mean by bottom to top. This place is a remarkable place to work because we've got colleagues who are willing to roll their sleeves up, and they do that work, and they do it oftentimes without thanks or appreciation. You know, people like me, I get to be on this radio show. I get to hear, people saying thank you for everything that you do. We have a lot of people in this hospital that they don't get that feedback. And that's what I try to take back to them. I have an opportunity every week, at least a couple of times, to go and round on different floors and in different departments. And that's one of the things that I like to do, is thank people for the work that they've done over this last year. I've done it today. Today's Doctor's Day. And, we sent a message out to all of our medical staff. And that was basically my message, is thank you for what you've done in this last year. More than ever, this last year has been really, really challenging. And I have a tremendous amount of gratitude for our staff here.
How many doctors Mercy Health has?
Well, we have about 750ish that are on our medical staff in total. Of course,
In
not all those
Muskegon.
come to the hospital. That's our community doctors plus the people who practice here in the hospital. But it's a fairly large medical staff, but we've got
Wow.
a big county here, and we're the only hospital system, and so most of them have privileges with us.
700. I was reading a report. I know we got to go. Papua New Guinea dealing with a COVID-19 increase. 8 million people, only 500 doctors. It's not good.
Yeah.
Muskegon 700 doctors, and we got maybe 179,000 people in the county. So, wow. Last comment, Will Warren, watching out of Washington, D.C. It's very interesting that the flu numbers are down when COVID numbers are not, yet the same protective measures are the same for both. Makes one wonder.
Yeah,
That's
that's a great question. And that gets back to what I talked about before and how contagious a particular virus is. In the case of COVID, we know that it is multiple times more contagious than influenza. So it's actually not terribly surprising that COVID numbers would be different than influenza numbers because it's not an apples to apples comparison. So if we know that COVID, let's just say, for example, COVID's 3 times as contagious as influenza, then we know that when COVID starts being passed around, it's going to be exponentially higher the number of people who get it than influenza because it's more contagious. So while I can understand on its surface, you would look at it and say, hey, they should be the same. It's not because it's not that apples to apples comparison.
right. Anything you want to say before we go, Dr. Grill?
No, thanks for having me today. I'd be more than happy to answer any other questions. If you get them offline, just let me know, and I'd be happy to shoot you an answer to them. But if you know somebody who's in healthcare, nurses, the people who clean the rooms here in the hospital, we call EVS workers, food service workers, physicians, anybody who's involved in the provision of care, please do thank them and thank them for their service. And we'll continue to do the absolute best we can to take care of our community. But please, one of the best ways you can help us, wear your masks, wash your hands, practice that physical distancing that we talked about, 6 feet, and get vaccinated.
All right, Dr. Grill. Thank you so much, sir.
Yes, sir.
Thanks.
Bless.